Thank you very much, Doctor. I appreciate you. At this point, we're going to go on to Cannabis and Pets. During our consideration of whether to allow medicinal cultivation facilities in our city, we did hear from folks that were associated with pet products. And I'll be very candid with you, I've not had a dog myself or a cat, but I know several that have and have had some serious issues with their pets. And I'm very honored to have Dr. Tim Shu VETCBD here with us to talk to us about veterinary medicine related to cannabis industry. So, Dr. Shu.
All right, good morning, everyone. Thanks for being here. I'm going to scroll through these. Yeah. This is all great information. You guys that are fast readers, you guys will be able to pick up all this. Yeah. Or for some of you guys have photographic memories. There we go. Yeah. All right, great. So my name is Dr. Tim Shu. I'm the founder and CEO of VETCBD, and what we do is we make medical cannabis products for animals. So a little bit of background about myself. I graduated from Texas A&M's College of Veterinary Medicine. Practiced in general emergency critical care medicine for a while before I started the company VETCBD back in 2015. And as I stated, we make cannabis products for animals. A lot of people are familiar with cannabis products for humans, but we actually use it extensively in animals, and it's strictly for medicinal purposes. A lot of people realize that cannabis has recreational use in people. They're not so familiar with the medicinal uses of it in people, but we really illustrate the medical aspects of cannabis when we're doing it for animals, because we're not here to get any animals high. We're here to produce medical benefits for animals. So the mission of the company is to improve the quality of life in patients by using medical cannabis. The reason why I started the company as a healthcare practitioner is because my philosophy is that as a healthcare practitioner, we owe it to our patients and our clients to be able to pursue all avenues of therapeutic benefit. If cannabis offers such a therapeutic benefit, then it's really up to us to be able to fully explore that and provide it to our patients and clients. Even if it doesn't have any sort of medicinal benefits, we really need to explore it to be able to say one way or the other. So why cannabis? Well, first of all, it has a remarkable safety profile. There is no established LD50 in humans or dogs. And what I mean by LD50 is it means a lethal dose by which half of the tested population will actually succumb to that substance. In cannabis, there is actually no established LD50 in humans or dogs. In humans, there's been no reported cases of death from overdose. Same thing with dogs. They've done some studies where they gave dogs massive amounts of THC before, and that actually did not result in any sort of fatal overdoses. So cannabis actually has a remarkable safety profile, and it's not just THC that's cannabis. We'll talk a little bit more about the other cannabinoids that are present. CBD is another major cannabinoid that we use for medicinal purposes, and that has a remarkable safety profile. It's been tested long-term, short-term, high doses, low doses in a number of animal species. And it has a remarkable safety profile. And this is in comparison to a lot of the other pharmaceuticals that we frequently use. As mentioned before, it's not to say that we should replace cannabis with everything. Cannabis should be thought of as an additional tool in the toolbox that we use to treat diseases. When we're looking at a lot of the traditionally prescribed pharmaceuticals, some of them can have severe side effects. For example, liver damage, kidney damage, or even GI ulceration. And with cannabis, we don't see any of those side effects. So it lacks the harsh or dangerous side effects that we typically will see in a lot of traditionally prescribed pharmaceuticals. But again, that's not to say that we should replace cannabis for everything. Cannabis has its place and its use, and so do a lot of traditional pharmaceuticals. For example, if you have thyroid issues, cannabis is not going to supplement your thyroid hormone. And it can be used for a lot of disease processes. That's one of the most amazing things about cannabis. When you're talking about pain, for example, you may be using opioids, but you're certainly not going to be using your opioids to do things like control nausea or control seizures. But what we see in cannabis is that because of the endocannabinoid system, because of how far-ranging it is, we find cannabinoid receptors in the central nervous system, and the lungs, the kidneys, liver, GI tract, and bone cells and immune cells. What happens is that cannabis, by interacting with the endocannabinoid system, is able to address a far-ranging number of disease processes. Oh, we got a little bit of a technical error here. But, well, you get to see a picture of a nice cannabis plant. But cannabis has been around for a very, very long time. It's not something that's something new. In fact, it's been used as medicine in ancient China for thousands and thousands of years. So it goes back a long ways, and it's not just used for medicinal purposes. It has a lot of use in agricultural and industrial purposes too. So the plant can be used for food. The seed is great for producing oil and food products. You can also use the stalk and the stem for fiber. So it's been used for rope, clothing, paper, even biofuel. One of the main cannabinoids that we see is cannabidiol. It's been receiving a lot of the press in the past few years, and rightly so. And the main reasons why is because first, it's non-intoxicating, meaning no matter how much you use, you're not going to get high from CBD. And it also has a very, very wide safety spectrum. As I mentioned before, CBD has been tested in a number of animal species at low doses and high doses, short-term and long-term periods, and they found it to be remarkably safe. That's also been our experience as well, is that when we're treating animal patients, we treat primarily dogs and cats, but we've also treated horses, birds, rabbits, guinea pigs, ferrets. As my colleague mentioned before, the endocannabinoid system is found in all vertebrate species. So we find endocannabinoid system in mammals, birds, fish, reptiles, and amphibians. And so all these species stand to benefit from cannabinoid therapeutics. CBD is pretty amazing because it has a number of therapeutic properties. One of the biggest ones is anti-anxiety. A lot of people don't realize that animals suffer from a lot of the same disease processes that humans do. And so when we're looking at treating these disease processes in animals, one of the biggest advantages that we have is that it's far less subjective. A lot of times when you talk to people, you ask them how they feel. But when we're looking at animal patients, it's far more objective because we're able to observe how they're doing. We're able to see that they're improving. And so animals can suffer from anxiety and stress just like people do. A lot of times from separation anxiety or noise anxiety from fireworks, for example. And the remarkable thing about CBD is that it actually reduces anxiety without causing a lot of harsh side effects like sedation or lethargy. CBD is also an anticonvulsant. What that means is that it helps to decrease the seizure frequency and intensity. So just like with people, we have a lot of animals that suffer from epilepsy, which is uncontrolled seizures. And over the course of the past few years, we've been able to treat a lot of these patients with cannabis, particular CBD, to be able to control their seizures. We've had a number of patients that have refractory epilepsy. What that means is that epilepsy that's not controlled well by traditional drugs. And a lot of these patients were actually, the owners were actually going to euthanize the patient, meaning put them to sleep, because the quality of life was so poor because the seizures weren't able to be controlled by traditional methods. So these patients were having full-blown seizures every single day. And a lot of them turned to cannabis as a sort of last resort. Before they turned to euthanasia, they said, why not? Let's give cannabis a try. And after they get cannabis to try, a lot of these patients actually had their seizure frequency drastically reduced. And when they did have breakthrough seizures, the seizures were far less intense than they were before. And so cannabis actually saved a lot of these patients' lives. It's also a neuroprotectant. They've done some really interesting studies in animal models that have shown that animals that either have CBD on board or have CBD administered after inducing stroke actually had better outcomes. This is also something that they're looking at in people when they're looking at contact sports or combat sports like football or MMA, for example. And so it's really important that we're able to utilize cannabis because as neuroprotectants, we're able to improve the outcomes in a lot of patients, whether through its trauma and accident, or whether it's through neurodegenerative diseases where the nerves are breaking down over time. One of the most important properties is the anti-inflammatory properties of cannabis and CBD. Inflammation, excessive inflammation is a bad thing. Normal amounts of inflammation are absolutely crucial, and we need that to do things like repair tissue or to be able to fight off disease processes. But anti-inflammatory aspects come into play when we're dealing with diseases that have excessive inflammation. So for example, like arthritis and degenerative joint disease, there's excessive inflammation going on in the joints. This can be very painful and debilitating. A lot of people, especially older senior citizens, are aware of this condition. And we see the same thing in animals. A lot of older senior animals, dogs, cats, birds, will get some degree of arthritis. And we've had a lot of them be able to control their pain, increase their mobility by using cannabis. It's also a well-known analgesic, meaning it helps to reduce pain. It's very, very useful in things like chronic pain and neuropathic pain. So for chronic pain, we don't necessarily have good modalities for treatment. There are things like non-steroidal anti-inflammatories, but they do come with their own drawbacks. A lot of them can be associated with things like liver damage, kidney damage, or GI ulceration. And there are also opioids. Now, opioids tend to be good for acute short-term pain, but in terms of a chronic pain control option, opioids leave a lot to be desired. So we've seen that cannabis can offer a very good pain control option for patients that are suffering from long-term chronic pain or neuropathic pain, meaning pain that has to deal with nerve damage. It's also used as an antiemetic. What that means is that it helps to control nausea. So we have a lot of patients that have, for example, chronic kidney disease. And chronic kidney disease, what happens is the kidney's not functioning like it normally should. And so what happens is the toxins will start to build up in the body, and that will cause the patient to be very nauseous. So we have a lot of cats, for example, that as they get older, they get some degree of chronic kidney disease, and they become very nauseous. And we've seen that cannabis and CBD is able to help control that nausea and restore quality of life and restore appetite in these patients. As mentioned before, it also has antineoplastic properties. And what that means is that it has anti-cancer properties. There does need to be more research in this area, which is why legalization has been great, is because it's allowed for a lot more clinical trials to take place, and it's allowed for a lot more studies to take place. We have seen some promising things with cancer. We have actually seen patients that were diagnosed with cancer and given only weeks left to live. They started on cannabis, and they were able to extend that timeline for much, much longer. Some weeks went to months, and some even went to a year or two. And there's a number of different mechanisms that cannabis utilizes to be able to control things like cancer proliferation. It decreases angiogenesis, which is blood supply to cancer cells. It also increases apoptosis, which is causing the cancer cells to die off, and also causes the immune system to eat more of those cancer cells. Now, let's touch upon THC. A lot of people are familiar with THC, and a lot of people realize that THC gets people high. But not so many people realize that THC can also be utilized for medicinal purposes. It absolutely has medicinal purposes. One of the most important things about utilizing THC is that it can be used together with CBD. And when it's used together with CBD, that actually helps to make it more effective. We hear a lot about CBD, but CBD utilized by itself is not as effective as when CBD is utilized in conjunction with THC. Now, THC does have dose-dependent intoxication, which means that depending on how much you take, you can get high from it. But it can be non-intoxicating at low doses. In fact, every single product that we've made over the past 4 years and every single dose that we've administered to the tens of thousands of patients that we worked with have amounts of THC in there. It's 20 part CBD to 1 part THC, and so every single one of these animal patients have been benefiting from getting some degree of THC without getting high. Now, some of the therapeutic properties of THC is that it produces appetite stimulation. CBD is great at controlling nausea, but it doesn't actually stimulate the appetite. In some of our patients, we want to be able to stimulate their appetite. For example, cats with chronic kidney disease, patients that have cancer, patients that have chronic GI conditions. We all want to stimulate appetite. A lot of these patients are wasting away because they're not hungry, they have no desire to eat, or they feel nauseous. Now, when I talk about this in animals, you can understand how this applies to humans as well, because a lot of times humans will get things like chronic kidney disease, they'll get GI conditions like Crohn's disease, IBD, IBS, and they can also be afflicted with cancer. THC also has anti-inflammatory properties, so it's great for conditions that have excessive inflammation, like arthritis, for example. It also has well-known pain-relieving properties, and it can also be used as an antiemetic, just like how we hear about people that have cancer or HIV using cannabis as an antiemetic to control nausea. We see the same thing in animals too. It has neuroprotective properties. As mentioned before, it's very, very interesting that the US government actually has a patent on cannabinoids as neuroprotectants, and there is a lot of studies being done in the human field for looking at cannabis in terms of neuroprotective properties for injury, for damage to the central nervous system, but also for degenerative diseases like Huntington's, Parkinson's, and Alzheimer's. In animals, we get senility issues, and so a lot of times when our animals get older, they get some degree of cognitive dysfunction, and so a lot of times what we see is, for example, some of these older dogs will pace around at night, they'll excessively vocalize, they'll seem like they're lost or confused, and we have a lot of these patients that actually utilize cannabis, and it actually helps to decrease their senility, and it actually helps to improve their cognitive function. And just like CBD, THC has antineoplastic properties, which means that it can help decrease cancer cells, it can help kill off some of these cancer cells. And we have seen that result in a lot of these patients. Now, it's not to say that every patient is going to benefit. One of the most difficult parts of cancer is that there's so many different permutations. We have hundreds of different kinds of cancers. We have a number of different cannabinoids, and we have a number of different doses and ratios that we're able to utilize. And so this is why one of the reasons why legalization and pushing for increased trials and research is so important, is because there's so much potential here. And we're really just starting to scratch the surface, and we're starting to learn more about how we can use these medicines to be able to benefit not just people, but also animals. So as I mentioned before, the clinical applications that we see on a day-to-day basis in animals and also in people for cannabis is things like pain control, anxiety and stress relief, decreasing inflammation, decreasing nausea and vomiting, stimulating appetite, protecting the nerves, and also decreasing seizure intensity and seizure frequency. So what are some of the reasons for legalization? Well, first, it allows clients to have safe local access to medication. Whenever clients don't have dispensaries in their city, what that means is they have to drive to other cities to be able to obtain that medicine. And when they drive to other cities to be able to obtain it, those cities are the ones retaining that tax revenue and not the cities that they reside in. Another reason for legalization is that people are going to utilize cannabis regardless of whether it's legal or not. And this is because many times it's life-saving for them. It improves their quality of life. And at the end of the day, that's what we're all about, is improving quality of life. And when we have legalization in place, what that allows for is it allows for lab testing. Lab testing provides clean, consistent quality medicine. So here in California, we have one of the most rigorous testing systems for cannabis. And so what that results in is when you go to a legal dispensary, the products that you find on the shelves are actually one of the cleanest products out there in terms of any agricultural or any sort of consumable product that you would find. It's cleaner than the stuff that you would find in your grocery stores. The other thing that legalization provides is that it lets healthcare providers provide guidance to clients and patients. When things are not legalized, everything kind of becomes hush-hush. And that's really unfortunate because it really damages the people that can benefit from it medically. When we have legalization in place, when we allow physicians, when we allow veterinarians to be able to talk to their clients, to discuss their patients' healthcare needs, that's when everyone benefits from this. Last but not least, the tax revenues benefit local communities. For example, a lot of cities have a cannabis business tax in place, and this cannabis business tax goes directly back to the local cities and local communities. So, we have it in San Diego where they have a 5% tax, and they've been able to benefit from that. And a lot of cities have similar structures set up in place so that the sale of cannabis can directly benefit the cities. And it's just a little bit about us. And I'll be sticking around afterwards to answer any questions that you guys might have. But thanks for listening. Thanks for your time. Really appreciate it.